When you must perform a complete physical assessment, do you know how to examine all body systems efficiently? Can you combine your assessments and minimize position changes to avoid tiring the patient and yourself? Do you know how to interpret your assessment findings? This program will show you how to assess your patient systematically from head to toe. It groups your assessments by body region and patient position for maximum efficiency and patient comfort. During this program, you'll see normal assessment findings. However, your patients may have some abnormal findings. If so, document your findings and refer the patient to a physician. Also, to avoid repetition, you'll see each test or technique performed on just one side of the body. In practice, of course, you'll repeat it as needed on the opposite organ or structure. Start the assessment by obtaining a detailed health history to help make the assessment more patient-focused. Remember to use active listening and observe the patient's mannerisms, facial expression, speech, appearance, body positioning, mood, and affect. Also note his level of consciousness, including degree of wakefulness and orientation to person, place, and time.
I'm going to give you a patient gown that I'd like you to get.
After obtaining the history, ask the patient to empty his bladder and provide a urine specimen if needed. Undress completely and put on a gown. While the patient is changing, gather the necessary equipment and warm the instruments and your hands if needed. Then consider your approach to the physical assessment. You'll need to use the 4 basic techniques: inspection, palpation, percussion, and auscultation, in various combinations during the assessment. You'll also need to explain the assessment process and answer any questions, provide instructions and information to promote patient comfort, drape the patient and expose only the area being examined, follow a logical sequence for assessment, compare both sides of the body, and examine the skin throughout the exam, checking for lumps and nevi. After having measured the patient's height and weight, take his vital signs, beginning with the temperature if needed. Remember to check the patient's radial pulse and respirations for 1 full minute. If the patient has a history of dizziness or fainting, check the blood pressure in both arms while he's sitting, lying down, and standing. To maintain universal precautions, remember to wear gloves as needed throughout the rest of the assessment.
Now we're going to examine your head and face.
Now begin the head-to-toe assessment, starting with the patient's head and face. First, inspect the head and face, which should be normal in size, shape, symmetry, and contour. Also look at the patient's hair, which should be evenly distributed, should not be extremely dry or oily, and should not contain scales or nits. Then palpate his scalp, which should be pink, mobile, and free of lesions. You may feel normal bony prominences in the forehead, sides of the parietal bones, and behind the ears. After changing your gloves, use the tips of your middle and index fingers to palpate the temporal arteries. Their pulsations should feel equal. Also listen for bruits over the temporal arteries. You shouldn't hear any. Then slide your fingers down slightly to the temporomandibular joints. As you palpate with your middle fingers, have the patient open and close his mouth. The joint should move freely and painlessly. This technique assesses joint mobility and the motor portion of the trigeminal nerve. To test the facial muscles and the motor portion of the facial and trigeminal nerves, have the patient raise and lower his eyebrows.
Bare your teeth.
Bare his teeth.
Okay, big smile.
Smile broadly.
Puff out your
Puff
cheeks.
out his cheeks.
Okay, and try to keep your mouth closed while I try to open it.
And keep his mouth closed as you try to open it. All of these movements should be symmetrical. If the patient has reported problems with his sense of taste, test the sensory portion of the facial nerve by having him identify sweet, sour, bitter, and salty substances.
It tastes salty.
To assess the sensory portion of the trigeminal nerve, assess the patient's ability to identify simple touch. Using a cotton ball or paper clip, have the patient tell you when he feels the object touch him.
No.
Check for simple touch sensations on both sides of the forehead, cheeks, and jaw. The patient should feel the sensations equally.
I'll check your sinuses
Next,
now.
press your
We know you've
thumbs
done
under the
great.
inner aspect of the orbits to palpate the frontal sinuses. And press under the zygomatic bones to palpate the maxillary sinuses. Lightly percuss these areas also. Sinus palpation and percussion should cause no pain or tenderness. If they do, assess the sinuses further with transillumination. When assessing the patient's eyes, begin by checking visual acuity with a Snellen eye chart. If the patient normally wears corrective lenses, he may wear them during this part of the eye
Okay,
exam.
now keep both eyes open.
With the
and
patient
cover your
20
right
feet
eye.
from the eye chart,
And read the
have him
smallest
keep
line.
both eyes open, cover one eye with a card, and read the smallest line of type that he can see.
P-O.
Note this line's numerator, which is always 20, the patient's distance from the chart, and its denominator, which is the distance at which the patient can read it. Normal vision is 20/20.
O.
Record the patient's vision for each eye and note whether he is wearing corrective lenses. Check extraocular movements to assess the extraocular muscles and innervation of the oculomotor, trochlear, and
Now we're
abducens
gonna test the
nerves.
muscles in your
Place your finger 12 inches from the patient's eyes. Have him watch your finger as it moves to the upper right, far right, lower right, lower left, far left, and upper left. The patient's eyes should move together equally and smoothly through these 6 cardinal fields of gaze. In the lateral fields of gaze, they may show 1 or 2 beats of nystagmus.
Now we're going to test for
To
accommodation.
test accommodation,
Forget my
hold your finger 4 inches from the patient's nose, then ask him to look at your finger, at the wall behind you, and
Look
back at your
my
finger. His pupils should constrict when they focus on your finger. Next,
And
perform the
your eye,
cover-uncover
look straight
test.
ahead.
While the patient stares at the wall behind you, cover one eye with a card and observe the uncovered eye.
Continue looking straight
It should
ahead.
not wander or move. When you remove the card, watch the eye that had been covered. It should not wander or move. Now assess the eyes and external eye structures. The eyes should appear symmetrical, and the eyebrows should be free of scaling. The upper eyelid should partially cover the iris, and the eyelashes should turn outward. Now test the oculomotor nerve by asking the patient to close his eyes. The eyelid should move symmetrically without tremors. Gently palpate the eyelids for nodules or tenderness.
Okay, open your right
Then ask the
and
patient to
look up.
open his eyes and look up as you invert the lower lid to inspect the lower conjunctiva.
And look there.
Continue by having the patient look down as you pull up on his eyelid to inspect the upper conjunctiva and sclera. The conjunctiva should be pink and free of exudate. The sclera should be white. Next, palpate the lacrimal apparatus by gently pressing below the orbit near the nose. Pressure here should not produce exudate or excessive tearing.
No.
Look straight ahead. I'll be looking at your eyes from the side.
After inspecting the patient's cornea and lens for opacities, test the corneal light reflex. To do this, have him stare straight ahead while you shine a light on the bridge of his nose from 12 inches away. If both corneas reflect your light in the same spot, the eyes are properly aligned. Next, inspect the pupils. Normally, pupils are 3 to 5 millimeters wide and equally round.
Now we're going to check and see how your pupils respond to light.
Also
That's
check the
second.
pupillary light reflex, which assesses the optic and oculomotor nerves. To do this, darken the room and shine your light on one pupil. Normally, this causes both pupils to constrict. For example, when light shines on the left pupil, it should constrict directly, while the right pupil constricts simultaneously and consensually. Before assessing the internal eye structures, prepare the ophthalmoscope by selecting the lens size, turning on the ophthalmoscope, and adjusting the aperture to find the largest beam of light.
Okay, I'm going to examine your eyes now.
To examine the
straight
patient's left eye, use your left eye and hold the ophthalmoscope in your left hand with your index finger on the lens selector. Have the patient look straight ahead. From about 15 inches away, shine the light on his pupil. You should see the red reflex, a reddish glow that fills the pupil caused by light reflection on the retina. Keep looking at this red reflex as you move toward the patient. As retinal details become sharper, follow the vessels until they converge at the optic disc on the nasal side of the retina. The disc should look like a creamy yellow or pink circle with distinct margins. Use 1 disc diameter, or 1 dd, to measure any retinal background lesions, and a clock face to locate them. Also observe the physiologic cup, which should be about half the size of the disc. The retinal vessels, which should pair a lighter, thinner artery with each vein. The fundus, which should be light red to brown red and free of lesions. And the macula, which should be about 1 dd temporal to the optic disc and should have no blood vessels. Always view the macula last because shining your light on it may cause tearing and pupillary constriction. Now assess the patient's ears. Ears can vary greatly in size and shape, but should always line up with the eyes. Next, inspect and palpate the ears. They should be symmetrical and should display no swelling, lesions, thickening, or pain. Now palpate the mastoid process behind the ear. This should produce no tenderness.
Okay, I'm going to touch your
Next,
hearing now.
screen the patient's hearing acuity by performing the voice, Weber, and Rinna tests. To do the voice test, gently occlude one ear with your finger. Stand 1 to 2 feet away from the patient's other side
14.
and gently wiggle your finger in his ear while you whisper a 2-syllable word like football or 14. He should be able to repeat the word.
Meatball. 13.
To do the Weber test, use a tuning fork of 512 to 1024 hertz. While holding the tuning fork by the stem, strike the tines on your palm. Then place the stem of the vibrating tuning fork midline on the patient's skull. If he hears the sound equally in both ears, he has normal hearing via bone conduction.
It's the same in both ears.
Okay, now we're going to do a test called the
To
Rinna
perform the
test.
Rinna
I'm gonna
test,
place the tuning
strike the
fork behind
tuning
your
fork
ear
again
tell me when
and
you
place
no
its
longer
stem
hear
on the
the
mastoid process. Count the seconds until the patient says he no longer hears the sound. This is bone conduction, or BC.
I don't hear it anymore.
Then immediately place the vibrating fork in front of his ear. Count the seconds again until the patient says he no longer hears the sound. This is air conduction, or AC. Air conduction should be about twice as long as bone conduction. Prepare to perform the otoscopic examination by attaching the handle to the head, selecting the largest speculum possible, and turning on and adjusting the light. To examine the right ear, hold the otoscope in your dominant hand. Then pull the pinna up and back to straighten the ear canal and insert the speculum into it. You can hold the otoscope with the handle down or up, but the up position provides more stability. Now inspect the external ear canal. Normally it contains hair and some cerumen, but has no redness, lesions, swelling, or exudate. Remember that whites and blacks usually have moist, golden brown cerumen, but that Asians and Native Americans typically have dry, gray, flaky cerumen. Now examine the tympanic membrane, or eardrum. It should reflect the otoscope light and appear shiny and gray with a white periphery. Its center should be concave and free of perforations. Note the malleus, the incus, and the light reflex.
Okay.
Finally, withdraw the speculum, clean it if exudate is present, and examine the other ear. To begin this part of the assessment, briefly inspect and palpate the external nose, which should be fairly symmetrical and should have no lesions, deformities, or deviations.
Okay, tilt your head back. Okay, now I want you to close one nostril with your finger.
Now have the patient
And
occlude
inhale.
one nostril while he inhales and exhales. Air should flow freely.
Side.
If the patient complained of loss of ability to smell during the health history, test the olfactory nerve by having him identify smells with his eyes closed.
Can you tell what that is?
Vanilla.
Next, inspect the nasal cavity with the nasal speculum
You need to look
or the
inside
short,
nose
wide-tipped
now.
speculum on the
Tilt your head
otoscope.
back.
Holding the speculum in your dominant hand with the blades closed, insert it about 1 centimeter into the vestibule. Keep the blades vertical and stabilize yourself by placing your index finger on the tip of the nose. Shine the pen light with your non-dominant hand as you gently open the speculum blades. With the patient's head tilted back slightly, view the nasal cavity. Coarse hairs should line its anterior surface. Ciliated membrane should line its posterior surface. Throughout the nasal cavity, the mucosa should appear red and moist, and there should be no lesions, drainage, or obstructions. Also observe the nasal septum. Remember that a deviated septum is normal unless it obstructs airflow. Finally, inspect the turbinates, which are located laterally. They should be light red and free of swelling, tenderness, and polyps. Before examining the mouth,
Do you wear
ask the
dentures?
patient to remove any dentures.
So examine your lips.
Then begin by inspecting the lips.
Part your lips.
They should appear moist and normal in color, should close symmetrically, and should be free of lesions, cracking, and edema. Next, palpate the lips, which should feel soft and smooth. Now ask the patient to bite down and bare his teeth while you assess jaw alignment. In the front of the mouth, his upper teeth should override the lower ones slightly.
Open your mouth.
Then assess the oral mucosa using a tongue blade and pen light. Normally, the mucosa is pink, smooth, and moist, and has no lesions or nodules. Remember that hyperpigmentation is common in dark-skinned patients. Also assess the teeth and gums. Normally, adults have 32 evenly shaped, ivory-colored teeth that are firmly embedded in the gums. Now inspect the rest of the oral cavity. The hard palate should appear bony and whitish. The soft palate should look muscular and pinkish. The uvula should be pink, midline, and free of lesions. The tongue's dorsal surface should be symmetrical and slightly rough with a midline groove and small fissures. The ventral surface should be smooth and pink with visible veins. Using a gauze pad, hold the tongue to one side and palpate the floor of the mouth. You should feel no lumps or indurations.
Okay, open your mouth and
Next,
stick out your tongue.
have the patient stick out his tongue. It should be midline and free from tremors.
Okay,
Then
now
put the
lay
tongue
next
blade to
your
the
tongue
side of the
try to
tongue
push
and
out
ask
your
the
tongue.
patient to push it away. Tongue pressure should be equal on both sides.
The other side.
These actions test the hypoglossal nerve.
Good. Open your mouth.
Also check the glossopharyngeal and vagus nerves by depressing the tongue and having the patient say ah. The soft palate should rise symmetrically and the uvula should remain midline. While the patient says ah again, assess the pharynx and tonsils. Their mucosa should be smooth and pink. Then grade the tonsils' size on a scale from +1, in which the tonsils are visible, to +4, in which they touch each other.